Sperm DNA fragmentation, a silent killer. If all your tests are normal, and yet you're not becoming a father, then maybe, just maybe, there's a silent killer hiding inside your body. If you watch this video till the end, you will surely be able to solve many of your own problems, causes and treatments, in a way you've never heard before. But first, let us ask you a question. Have you ever wondered, if my sperm count, motility, and shape are all normal, then why is my wife still not getting pregnant? Welcome to HealthBridge Europe, your very own channel. We are your partners in health, and today's topic might change the way you think about male infertility. Let's begin with the most important question. If my semen analysis report is always normal, then why does my wife suffer repeated miscarriages? Why am I still not able to become a father? If you don't have an answer to these questions, then this video is for you. Because the enemy you're fighting is invisible. It doesn't hurt. It doesn't show symptoms. And yet, it silently destroys your dream of fatherhood. It's called sperm DNA fragmentation, the silent killer. Chapter 1. What is sperm DNA fragmentation? We often define male fertility by just 3 things. 1. Sperm count. 2. Sperm motility. 3. Sperm morphology, shape. But according to Dr. Sheena Lewis from Queen's University, Belfast, UK, a normal semen analysis can hide serious DNA damage in sperm, and this is one of the top causes of unexplained infertility. And this damaged DNA can either prevent a pregnancy from occurring or terminate it before it even begins. Chapter 2. What are the symptoms of DNA fragmentation? This is the most dangerous part. There are no physical symptoms. That's why it's called a silent killer. But then, how do you know you have it? Here are the signs to watch for. Your wife has had multiple miscarriages. Your IVF or ICSI cycles keep failing. Your semen analysis is normal, but pregnancy never happens. You are above 35 years of age and still not conceiving. If any one of these applies to you, then you might be dealing with sperm DNA fragmentation, and you may not even know it. Chapter 3. Is a regular semen test enough? No, it is not. A semen analysis can tell you how many sperm you have, how well they swim, what shape they are. But here's the truth. It tells you nothing about their DNA, and that's the most critical part. As Dr. Ashok Agarwal, director of the Andrology Center at Cleveland Clinic, USA, says, healthy-looking sperm can carry fragmented DNA, making them functionally infertile. So even if your sperm look fine, they may be genetically broken. Chapter 4. What is the DNA fragmentation test? To detect this hidden issue, there are specialized tests. SCSA, sperm chromatin structure. Assay. 2. Two-nail assay. 3. Comet assay. 4. SCD test, sperm chromatin dispersion. These tests measure the percentage of sperm with broken DNA strands. Example results: less than 15% fragmentation, normal between 15 to 30%, borderline above 30%, high risk. Chapter 5. What causes sperm DNA to break? The 7 big culprits. 1. Stress. High cortisol levels damage sperm quality. 2. Obesity. Excess fat increases oxidative stress in the testicles. 3. Smoking and alcohol. Even one cigarette can poison sperm from the inside. 4. High temperatures. tight underwear, laptops on the lap, or frequent saunas all overheat and harm DNA. 5. Varicocele. Enlarged veins in the scrotum reduce oxygen and break down sperm DNA. 6. Environmental toxins, pesticides, heavy metals, and plastics. All are silent killers. 7. Age. After age 40, the risk of DNA fragmentation doubles. Chapter 6. What happens if fragmentation is high? It's not just infertility. Sperm DNA fragmentation can also cause IVF or ICSI failure, implantation failure, repeated miscarriages, embryo development arrest. In short, even if fertilization occurs, the pregnancy may not survive. Chapter 7. Can sperm DNA fragmentation be treated? Yes, but it requires time, discipline, and guidance. According to Dr. Stefan Schlott, head of reproductive biology at the University of Münster, Germany, men can improve their sperm DNA integrity within 2 to 3 months through lifestyle correction and medical guidance. Here are the 6 core treatment principles. 1. Lifestyle changes. Lose weight. Quit smoking and alcohol. Wear loose underwear. Get enough sleep. 2. Mediterranean diet. More vegetables, fish, olive oil, and nuts. Antioxidants reduce DNA damage. 3. Supplements. Under doctor's advice. Zinc, CoQ10, vitamin C and E, omega-3s. 4. TSE, testicular sperm extraction. If fragmentation is very high, doctors can extract sperm directly from the testicles, which usually has less DNA damage. Number 5. IVF with IMSC or PICSI. Advanced technologies that select sperm with the healthiest DNA. 6. Avoid heat and radiation. No saunas, hot tubs, or phones in the pocket. Chapter 8. Why you should consider fragmentation testing. Before or after marriage. Infertility is no longer just a female problem. Today, in over 40% of all infertility cases, the male factor is involved. So if you are getting older, you married later in life, or your IVF is repeatedly failing, then a fragmentation test is not optional. It's essential. Because sometimes a small test can save you from a lifetime of loss. Emotional close. The question is not how many sperm you have. The real question is, are the sperm you have truly whole inside? Will your dreams of fatherhood be destroyed by an invisible weakness? Or will you rise up and face the silent enemy before it's too late? Remember, silent killers strike from behind, and when the strike is unseen, there's no defense. But if you take the fragmentation test today, then maybe, just maybe, your child will be in your arms tomorrow, not just in your dreams. And end screen note. This video is for educational purposes only. Please consult a certified medical professional for diagnosis and treatment. HealthBridge Europe, where the truth is not hidden, it's explained.